Female Infertility by Holly Costanzo. So what is infertility? It's a medical condition in which there is failure of achieving pregnancy after 1 year of trying to conceive. It can be due to a defect in the male or female reproductive system. In terms of the female reproductive system, the ovaries, uterus, or fallopian tubes may be abnormal. In the male reproductive system, there may be a low sperm count or abnormal sperm shape or motility. So there's primary versus secondary infertility. Primary is when a woman has never been pregnant and cannot conceive after 1 year of trying. Secondary is when a woman has had at least one previous pregnancy but has difficulty conceiving again. So some causes and risk factors. Polycystic ovarian syndrome, PCOS, is the most common cause of infertility. It's when the ovaries produce higher than normal levels of androgen. There's also hormone imbalances, uterine polyps, which are just growths that develop in the lining of the uterus and can affect implantation of the eggs. Fibroids, which are benign tumors that grow in the uterus and can block the fallopian tubes. Adhesions, which are just bands of scar tissue that form in the uterus. Some causes can also be sexually transmitted diseases, if chlamydia and gonorrhea are gone untreated, they can form pelvic inflammatory disease. Endometriosis, pelvic surgery history, chronic diseases, multiple miscarriages, overweight, and age over 35 years old. Incidence and prognosis. So 1 in 6 experience infertility worldwide, and a third of cases are due to male reproductive issues. Another third of that are due to female reproductive issues, and another third are due to both male and female reproductive issues or due to unknown causes. Prognosis-wise, 9 out of 10 couples get pregnant following fertility treatments. So just some signs and symptoms a woman may experience if they're infertile: an irregular, absent, or painful menstruation, abnormal hormone levels such as thyroid hormone and prolactin. So prolactin can impact the release of LH and FSH, which are needed for normal menstruation and ovulation. And too much or too little thyroid hormone can impact the ability of the egg to be released from the ovaries. And women can also experience abdominal pain and painful intercourse. So, why is this topic relevant? So, infertility impacts many families worldwide. Both males and females can experience infertility. However, it's often perceived that females are the ones that suffer from it, even though males contribute nearly just as much. And infertility can lead to feelings of depression, anxiety, low self-esteem, and stress. So before getting into the diagnostic imaging, I just want to make it aware that imaging alone is not enough to diagnose infertility. Different diseases such as PCOS, endometriosis, and hydrosalpinx are typically found within infertile imaging. So in order to diagnose between infertility and other diseases, you also need to take into account the patient's reported symptoms and their lab work. So the first imaging tool is the transvaginal ultrasound. So this is an imaging technique in which a transducer is inserted into the patient's vagina to get a better look at the reproductive organs to see if there is dysfunction or abnormalities. It is the primary imaging tool used to diagnose infertility. It's typically used when there is suspected infertility, endometriosis, PCOS, ovarian dysfunction, tubal occlusion, or recurrent pregnancy loss. It essentially visualizes female reproductive organs such as the cervix, uterus, ovaries, fallopian tubes, as well as analyzes follicular development. So in the ultrasound image, when you look at the ovaries, you may see what looks like a string of pearls, just like in the picture to the lower right. These are follicles of the ovaries. When they're arranged like this, it can typically be a sign of PCOS, which can be a common cause of infertility. Ovarian cysts may be seen as well. So in regard to the uterus, fibroids and polyps may be seen. In the fallopian tubes, there may be a blockage of what is called a hydrosalpinx. So just some advantages to transvaginal ultrasound. There is no radiation used. It detects common causes of infertility, and it's very inexpensive compared to MRIs. So pelvic MRI without IV contrast. It essentially uses magnetic fields to create detailed pictures of organs and structures in the pelvis. It is essentially used when there is suspected infertility, endometriosis, recurrent pregnancy loss. So typically in these images, in a T1 weighted image, it detects blood, which can be a big indicator that a woman is infertile. And then in T2 weighted images, it may detect fluid-filled structures such as ovarian cysts and can also get a sense of the follicular count. It can also pick up on fibroids due to adenomyosis. And it can also detect if there's blockages of the fallopian tubes. So just some advantages. It is non-invasive. There is no radiation that is used. And it is very good at visualizing soft tissue. So the third diagnostic imaging technique is the fluoroscopy hysterosalpingography. So essentially this is an x-ray of the uterus and fallopian tubes using an iodinated contrast dye. So it is essentially used when there is suspected infertility or fallopian tube occlusion. So in the imaging findings, typically after the dye is injected, an abnormality is essentially when only one or no fallopian tubes fills with the dye. This typically indicates that there is a blockage which impacts the sperm and the egg's ability to meet. Another finding will be hydrosalpinx, which may be present when there are fluid-filled tubes that are not due to the dye. This can indicate an infection, which again can impact egg and sperm meeting. And then there may also be a bicornuate uterus, which is when two horns are present in the uterus, which can indicate that there is trouble with implantation of the egg. So some advantages to this imaging technique. It checks the status of the fallopian tubes, and it is very accurate at detecting abnormalities. So these are just some images to represent the three imaging techniques. So to the left is that transvaginal ultrasound. In the middle, that is pictures of the MRI without IV contrast. And to the right are just some images of the fluoroscopy hysterosalpingography. As you can see, the dye falling into the fallopian tubes. So just some differential diagnosis. Polycystic ovarian syndrome. Typically, when somebody has this syndrome, they're able to conceive. However, when somebody has infertility issues, they are unable to conceive. So that is a good indicator as to whether somebody has this syndrome as opposed to just being infertile. Imaging-wise, the ovaries are enlarged. You'll see that string of pearls. and the uterus appears to be normal. And you typically, when you have infertility, the uterus typically has some abnormalities associated with it, such as polyps. For endometriosis, imaging-wise, you'll typically see a ground glass cyst, which is imaged down below. You'll typically see endometriomas, and polyps are typically not seen in endometriosis, as opposed to them being visible when somebody has infertility issues. You'll also have painful bowel movements and urination when you have endometriosis, and you will not have that when you are experiencing infertility issues. So just some medical management. Just some medications. Clomiphene, it encourages monthly release of the egg, and it typically has an 80% success rate of getting pregnant. Metformin helps manage PCOS. Gonadotropin helps stimulate ovulation in women and has a 30% chance of having multiple births following taking that medication. Just some surgical procedures. Laparoscopic surgery. It treats endometriosis, and the prognosis with this procedure is 45 to 75% of women get pregnant following surgery. Fallopian tube surgery. It helps create openings when there's blockage present. And then just some assisted conception treatments. So for in vitro fertilization, the egg is fertilized with the sperm in a lab, and then the egg is returned to the womb. And typically this tends to have a 40% success rate between the ages of 35 to 37 years old, and the rate gets lower as you get older. So for intrauterine insemination, that's typically when the sperm is inserted into the womb, and there typically is a 40% success rate after 3 rounds of trying. So for physical therapy involvement, there's pelvic floor physical therapy, which can help deal with infertility in a variety of ways. It can help decrease pain and discomfort, improve blood flow, and improve tissue mobility and muscle function. So physical therapists can perform techniques such as muscle relaxation techniques or myofascial release, scar tissue mobilization, and visceral manipulation. And it's been found that 54.6% of women with different conditions such as endometriosis, occluded fallopian tubes, decreased follicular stimulating hormone, or PCOS, become pregnant following various treatments of manual physical therapy. So just the physical therapy involvement and plan of care. So typically in a session, manual therapy-wise, a PT will perform myofascial release, whether that be of the pelvic floor muscles, the levator ani group, or the hip muscles. They may also perform a visceral manipulation or scar tissue mobilization. Following manual therapy, they may include exercises such as pelvic tilts, cat-camel, deep squats, or bridges to help get those muscles moving better and to allow the woman to have better control over her body. And it's also important to note that physical therapy should be used in conjunction with yoga and breath work as well, to really help the muscles relax and to get the woman in a better state of mind. And these are just my references. Thank you.